We'll talk about a horrifying event that affected the Owen family today. Isabella Owen, a small Hartlepool youngster, had just turned 3 in 2021. She was as joyful, content, and full of life as any other little child. The Owen family was experiencing complete happiness. But Isabella was a little under the weather in early August. Rob and Amy Owen, her parents, believed as much, at least. Then an odd event took place. Isabella began to breathe poorly and snore. Amy took her daughter to the doctor when she thought she could have hay fever. However, it was written off as nasal polyps. As matters worsened, Isabella's mother's intuition became stronger. The events that transpired thereafter resembled a terrifying film. Stop. The thought of their daughter going through something they didn't understand scared Isabella's parents. In a hurry, they headed to James Cook University Hospital to find out Isabella's condition. After evaluating her, the physicians advised the family to head straight to Newcastle's RVI. Isabella's family received the most heartbreaking news of their lives on August 27, 2021. A rare soft tissue malignancy called nasopharyngeal carcinoma invaded Isabella. The family had not considered this diagnosis. Pause. Let's start by discussing how serious this cancer is. First, let's discuss how serious this cancer is. The topmost portion of the neck is called the nasopharynx. This structure resembles a hollow tube made up of intertwined throat muscles. It is located directly above the roof of the mouth and behind your nose. Since it facilitates the flow of air from your nose to your lungs, the nasopharynx is the most important component of your windpipe. The nasal cavity and throat cells are impacted by nasopharyngeal carcinoma. Nasal cells have the ability to proliferate uncontrollably and obliterate nearby tissues. Teens are more affected than younger people. The incidence of nasopharyngeal carcinoma is also low. Every year, it affects 1 in every 100,000 individuals. Stop. Why is this cancer occurring? Why is this cancer occurring? A child's risk of nasopharyngeal cancer is increased if they have an extensive family history of the disease or if they have contracted the Epstein-Barr virus. Usually, this cancer begins with a slight headache, stuffy or plugged nose, and nosebleeds. Amy had noticed Isabella exhibiting these signs. Following this point, the cancer recurs, resulting in lumps in the oral and nasal passages, speaking difficulties, infections, and earaches. Isabella's cancer had not aggressively spread to other regions of her body because the physicians had discovered it quite early. It was therefore curable. The family was greatly relieved to hear this news. Children's nasopharyngeal cancer is well known for quickly spreading to the liver, lungs, and bones. Metastatic tumors are those that develop after cancer cells have disseminated. Secondaries is another name for them. These secondary tumors of nasopharyngeal carcinoma typically reside in the lungs. That in and of itself does not cause lung cancer in a person. Under such circumstances, the malignancy is classified as metastatic nasopharyngeal cancer. Tests were performed by the physicians to verify the cancer's spread. A process known as cancer staging. To rule out high-risk conditions and determine whether the brain, spinal cord, muscle reflexes, and other sensory organs are normal, they first do a thorough neurological exam. Because the nasopharyngeal cells are close to the chest, doctors may also perform CT scans or chest X-rays. In order to observe interior organs on the scan more clearly, they additionally inject a contrast dye. Tissues can be seen more clearly and brightly with a PET scan. The majority of the time, the doctors are powerless to help youngsters whose cancer has progressed to this point when they arrive at the hospital. Isabella, fortunately, had time on her side. The doctors had to select a cancer treatment with great consideration. Chemotherapy, radiation therapy, surgery, and immunotherapy are the standard treatment choices. Prior to moving forward, let us briefly talk about these. Chemotherapy involves injecting a number of powerful chemicals or medications to halt the cancer cells' rapid growth. Taking these medications orally can also stop cancer cells from proliferating. Supersaturated X-ray beams are used in radiation therapy to destroy cancer cells. Through the use of an external device, the high-energy rays are directed into the area that is damaged. This approach may be sensitive to technique since focusing the beam on healthy cells may have unfavorable outcomes. The enlarged tissues had to be severed surgically as the next course of action. The specific location of Isabella's malignancy meant that accuracy in the surgical technique was essential. A small surgical error could damage the windpipe's healthy portion. This drastic approach was therefore the last resort. Immunotherapy was the next most promising course of treatment. Put simply, this treatment strengthens the patient's inherent immunity. It is a biotherapy that strengthens the body's defenses against cancer naturally. Stop. At this point, Isabella's nose had a little mass of malignant cells protruding from it, which the physicians noted. Since it was so small, Amy never considered that it might be cancer. Isabella's breathing tube was quickly installed to enable unfettered breathing. Amy also remembers Isabella's tumor hanging at the back of her throat. The small child snored because this lump blocked her windpipe while she slept. In order to facilitate her breathing and lessen her snoring, a nasal tube was placed into her nose. Additionally, Isabella's obstructive sleep apnea, which had worsened over months, significantly improved. A medical condition called sleep apnea causes interrupted sleep because it restricts breathing. It disrupts your sleep pattern and raises your risk of heart attack and stroke in addition to causing exhaustion, drowsiness, and exhaustion. Isabella was able to cough up half of the tumor once due to the cancer's quick growth. The sight appeared as if it were from a horror film. For any parent, witnessing their child in unbearable pain can be an absolute nightmare. Children with the condition currently have a 38% survival rate. That's why the Owens started their treatment right away. Isabella was given chemotherapy by the medical professionals. For 6 weeks, she underwent aesthetics 5 days a week. Even in adults, chemotherapy can have some severe and enduring side effects. Your body may become brittle and your capacity to move and speak may change overnight. But Isabella remained upbeat despite her tortuous treatment. She was only depressed when she was holding tubes. She ran around the ward, though, as if nothing had changed, after they were taken off. For intense treatment, she even needed to travel to Manchester. This resulted in scabby congestion on her nose and helped decrease the malignant cells. It also resulted in a slight chronic redness. The child remained optimistic even after going through one of the most excruciating medical treatments. She didn't care about the severe side effects, such as hair loss. Isabella's risk of skin cancer has increased due to extensive radiation. Her parents now have a responsibility to shield her from the sun's rays and apply sunscreen to her every time they go outside. The most terrifying aspect of pediatric nasopharyngeal carcinoma is its high likelihood of recurrence and lack of response to therapy. After a few months of therapy, Isabella's parents took her for a screening with this worry in mind. Now, though, what? There are no discernible tumors on her most recent MRI. She has no cancer at all. Isabella had shown to be a formidable little fighter. View the TikTok video that her mother shared following her recuperation. Her parents wish to tell the tale to every family dealing with pediatric cancer. Additionally, they want to think positively because in October, Isabella will acquire a younger brother. Isabella continues to get maintenance therapy, but she now has more independence. With a Hickman on her chest, she carries on leading a life that is almost normal. For Isabella's family, the 7 months of struggle to get her in and out of the hospital was financially, physically, and emotionally draining. Their resources were depleted by having to travel 40 miles each day to get to the hospital. A sizable portion of their resources were used for therapy, medications, food, gas, parking, and doctor appointments. Isabella, who would have celebrated her birthday without cancer in the previous few months, wants you to visit Peppa Pig Land, stay at the CBeebies Land Hotel, and go to other locations. Rob and Amy are making a lot of effort to offer her another opportunity at living and to recognize her as the amazing warrior that she has been. To assist cover the costs of all the events she has missed because of her cancer, they have organized a fundraiser. Please click the link in the description box to make a donation to Isabella. Isabella is one of the 1.6 million Americans who receive a cancer diagnosis each year. Being extremely watchful of what you eat might be beneficial because cancer cells can primarily get their fuel from an improper diet. See Top 5 foods that cause cancer that you should steer clear of or 12 foods that cause cancer that you should not consume. Proceed now. To find out how to lessen the likelihood that cancer will invade your body, click 1, or better yet, watch both. Do you know anyone who has had cancer? Tell us in the comments section below.